Hi, my name is Lindsay Vanisteg, and I chose to watch the Split movie. Accuracy of portrayal of mental illness. How is the character shown to be mentally ill? The main character in the movie of the 2017 movie Split, Kevin Wendell Crumb, has been diagnosed with dissociative identity disorder, which is DID, indicating that he has a mental illness. His 23 different personalities, which control his behavior at other times, are a metaphor for this illness. Every identity has distinct qualities. For example, Dennis is inflexible and obsessive. Hedwig is a 9-year-old boy, and Patricia is calm and in control. The film uses Kevin's sudden personality shifts and facial expressions to illustrate his mental illness vividly. His sudden changes often confuse or frighten others, demonstrating his lack of cognitive control. Does the film say what the condition is? Indeed, yes it does. It is made very evident in the 2017 movie that the protagonist suffers from dissociative identity disorder, which is DID. His therapist, Dr. Dot Fletcher, who specializes in treating DID patients, makes explicit reference to this diagnosis. She discusses Kevin's case and explains the condition to him and his coworkers throughout the film. Through clinical observations and therapy sessions, Fletcher can identify Kevin's disorder because she observes his various personalities, or like the alters, each of which has distinctive behaviors, voices, and physical traits. She reports that she has seen unmistakable signs of identity changes during treatment, and that Kevin's personas interact with her via emails. According to her expert explanations, DID is a reaction to severe childhood trauma in which the mind constructs distinct identities to shield itself from unpleasant memories. What is the diagnosis criteria? Dissociative identity disorder is the mental illness that Split portrays. The Diagnostic and Statistical Manual of Mental Disorders, which is the 5th edition, lists the following diagnostics. It is identity disruption, memory gaps that reoccur, clinically crucial for memory, not a typical aspect of religious or cultural norms, and it's not because of substances or any illnesses. Does this character meet the criteria? Although the portrayal is greatly exaggerated for dramatic effect, Kevin Wendell Crumb, the main character, does seem to fit in many of the DSM-5 criteria for dissociative identity disorder. Identity disruption, which can be Kevin, unquestionably satisfies this requirement. He displays 23 distinct personalities, each with its own name, voice, mannerisms, and behaviors. When control switches between identities, he occasionally looks confused or disoriented, and some of his alters are oblivious to the actions of the others. This is the reaction of the amnesia or blackouts that are typical for DID patients. Clinically significant distress or impairment. His illness makes it difficult for him to carry out his daily activities. He finds it challenging to maintain regular daily routines, jobs, and his relationships. His dependence on his therapist and loneliness indicate that the disorder significantly disrupts his life. He satisfies this requirement since his symptoms are unrelated to any spiritual or cultural belief system. Not as a result of substance abuse or illness, the movie makes no mention of drugs, alcohol, or any other health problems as the cause of his symptoms. In what ways does the movie accurately represent the disorder? Kevin's multiple distinct personalities, each with its own voice and behaviors, are accurately portrayed in the film. Memory lapse and loss of control. Kevin suffers from blackouts or episodes or memory loss. When others identify, they take over. People who suffer from DID frequently lose track of time and are unable to recall what transpired when another alter was in charge. Therapeutic relationships. Dr. Fletcher's sessions with Kevin show more valuable aspects of therapy, such as her focus on understanding his personality and her recognition that DID is a response to trauma rather than a sign of weakness. Rapid identity changes in the movie. Kevin experiences quick, dramatic identity changes that are amplified for dramatic effect. Changing between alters can be more subtle and not always apparent to others in real life. Absence of practical treatment is the film doesn't show coping strategies or long-term therapy. Rather than that, they're promoting understanding. It highlights anxiety and tension. Treatment recommendations. How is the illness treated in the movie? In the 2017 movie, Split, Kevin Wendell Grumm's dissociative identity disorder is primarily treated through psychotherapy with his therapist, Dr. Karen Fletcher. Fletcher tries to identify and engage with Kevin's voice, various personalities, during their sessions to support their coexistence and foster self-awareness. She is aware that some of his personas, such as Dennis and Patricia, are dark and more controlling, while others are light, protective, or helpful. Her therapeutic approach focuses on reducing stress, building trust, and stopping harmful behaviors. However, the treatment plan is dramatized in the film. Instead of showing long-term and consistent therapy, which is the real-life standard for treating the DID patients, the film mainly uses their sessions to build suspense. As Kevin's condition worsens, especially when the supernatural beast identity takes over, his personality becomes more dominant and unresponsive to Dr. Fletcher's help. What other treatments or resources are available? Dissociative identity disorder sufferers, like Kevin, may be able to manage their condition better than is portrayed in the film, with the use of several useful scientifically validated therapies and tools. Psychotherapy is the first line of treatment. Long-term psychotherapy with a trauma focus is the mainstay or therapy for DID patients. The goals are to help the person process traumatic memories, improve communication skills between identities, and ideally integrate the different aspects of their personality into a single, cohesive sense of self, focusing on crisis management and the safety. People with DID may feel distressed, confused, or even have suicidal thoughts, so having a crisis plan and access to emergency mental health services is crucial. Examples of this include a trustworthy therapist, a crisis hotline, or even a haven to retreat to when symptoms worsen. Lifestyle and workplace support with the help of social workers, occupational therapists, or even case managers, a person with DID can maintain stability in their daily life by creating healthy routines, coping strategies, and self-care practices. What might be a possible or a treatment plan for this character? For Kevin, who is portrayed as having DID, a potential occupational therapy treatment plan would concentrate on enhancing his everyday functioning, self-management, emotional regulation, and safety rather than treating the mental illness directly. Social disengagement and minimal involvement in local events, inadequate self-care, and a chaotic home, the loss of control causes anxiety and fear. We can use the COAST format. So the C would be yes, Kevin will. The O would be create and stick to a regular morning schedule. Examples would be like breakfast and cleanliness and his attire. A would be using structured supports and visual cues. S would be every 5 days of the week. And then T would be in less than 6 weeks, Kevin will support emotional regulation by participating in one stress relieving recreational activity, like journaling, yoga, or even art, at least 3 times a week. Kevin is going to present 3 coping mechanisms to control anxiety and avoid dissociation during stressful situations. Assist Kevin in finding fulfilling roles and pursuits that provide him with a sense of purpose outside of his disorder, such as a volunteer work, hobbies, or job related duties, working together with the mental health team. Develop a consistent care plan in close collaboration with his case manager, psychiatrist, and therapist. Organize sessions to reinforce techniques acquired in psychotherapy and apply them to real life situations. What safety concerns may need to be considered? During treatment, Kevin might have dissociative episodes or abrupt identity changes, confusion, disorientation, or distress could result from these. To lower the risk of dissociation, the occupational therapist should ensure that the setting is quiet, regulated, and free from stimuli that could trigger dissociation, potential for self-harm or harm to others. Some of Kevin's personas, such as Dennis and the Beast, exhibit aggressive and erratic behavior. To prevent re-traumatizing him, the occupational therapist must approach therapy with tact and trauma-informed care. Environmental security: when different personalities emerge, Kevin might become scared or confused. So the therapy area should be a safe, calm, and predictable environment. Eliminate potential hazardous items such as heavy objects and sharp tools, and ensure supervision and clear exits with well-defined boundaries and consistency. This helps avoid emotional dependence or mistrust and lessens personality confusion. Medication and healthcare management: since different identities may not have the same memory or awareness or medical procedures, the OT should keep an eye out on Kevin's adherence and awareness if he is prescribed medication for symptoms like anxiety or depression. What are the false statements or depictions of mental illness in the film? The film misrepresents DID suffers as dangerous, violent, and unpredictable. Kevin's alter ego, the Beast, turns into a superhuman killer, instilling fear in those who suffer from it. And are they accurate depictions? Multiple identities are present. Kevin's numerous identities are consistent with DID. Every identity or alter may have distinct roles, names, and mannerisms. And why are aspects of illness so misrepresented? The film is a psychological thriller that aims to captivate and frighten its audience. By inflating DID symptoms and incorporating supernatural elements, the story becomes more suspenseful, keeping me very involved in it and keeping viewers on the edge of their seats while trying to watch it. Public comprehension is deficient since many viewers are unfamiliar with DID. Filmmakers use stereotypes to make the disorder easily identifiable, but this strategy usually yields false information. Here is my reference list.